Bismillahirrahmanirrahim. Quote for the day is: God does not burden any soul with more that it can bear. The topic for today's presentation is accidents and head-on matrix. I am Dr. Ayesha Amin, PGR of FCPS Community Medicine at Institute of Public Health, and I will be presenting this under the kind supervision of Professor Dr. Saira Afzal, who is the Dean of IPH. The learning objectives for today's presentation is introduction to injury and accident, type of accidents, risk factor of different types of accidents, prevention in relation to accidents and their control, head-on matrix, recent advances, and multiple choice questions. The learning outcome: at the end of this presentation, the participant will be able to describe about injury and accidents, type of accidents, risk factors, and their prevention, and to be able to answer the MCQs. Injury. An injury is the physical damage that results when human body is suddenly or briefly subjected to intolerable levels of energy. It can be badly lesion resulting from acute exposure to energy in amount that exceed the threshold of physiological tolerance. It can cause impairment of function resulting from lack of one or more element, as in drowning, strangulation, or freezing. So, what causes injury? Injury results from transfer of five types of energy to body. Number one is mechanical energy, for example, falls, motor vehicle crashes. Number two is electrical energy, which result from electrocution and lightning. Thermal energy, that is transferred in the form of burns. Chemical energy in the form of corrosions and radiation, for example, electromagnetic radiations. So injury, it is basically classified into intentional injury and unintentional injury. The intentional injury is further classified as self-inflicted injury and other injuries, while unintentional injuries include road traffic accidents, falls, drowning, poisoning, fires, and others. We will discuss all of this in one by one. So let's start with accidents. An accident is defined as it is an event that is unexpected, unintended, unplanned, and may result into injury to the person or damage to the property. WHO defined accidents as unpremeditated event resulting in recognizable damage. Types of accidents. The accidents are classified as road traffic accidents, domestic accidents, industrial accidents, railway accidents, violence, fall, drowning, and burns. Coming to road traffic accidents, which are the most common type of accidents, according to the United Nations Disaster Risk Reduction, the road traffic accident is defined as a road traffic accident involving at least one road vehicle in motion on a public road or a private road to which the public has the right of access, resulting in at least one injured or killed person. Problem statement. Approximately 1.19 million people die each year as a result of road traffic accidents. Road traffic injuries are the leading cause of death for children and young adults aged 5 to 29 years of age. 92% of the world fatalities on the road occur in low and middle income countries, even though these countries have around 60% of world's vehicles. More than half of all the road traffic accidents are among vulnerable road users, including pedestrians, cyclists, and motorcyclists. Road traffic crashes cost most countries to spend 3% of their gross domestic product. This table shows the summary of accidents in Pakistan. This table is taken from the National Transport Research Center website, and it shows that in 2023 in Pakistan there were almost 4,898 accidents were reported in accidents happened in which 4,898 were fatal and 4,493 were non-fatal. And in all of these accidents, almost 5,902 people were killed and 11,164 were injured, while the total number of vehicles that were involved in these accidents were 14,415. And in 2023, the total number of accidents that took place were 9,391. So what are the factors which causes road traffic accident? There are multiple factors which are leading to the accidents because it is a complex phenomena. The factors include human factors, environmental factors, mechanical or technical factors, and socio-economic factors. Coming to the human factors, it involves physiological factors and behavioral factors. The physiological factors include age. Road traffic injuries are the leading cause of death for children and young adults aged 5 to 29 years. Two-thirds of the road fatalities occur among people of the working age, that is 18 to 59 years of age. Genders, the male are typically three times more likely to be killed in road crashes than female. Health condition, certain condition leads to a road traffic accident, including seizures, heart attack, poor vision and hearing impairment, and cognitive impairment, which include dementia, mental illness causing confusion, and poor decision making. Behavioral factors, which involve risky behavior, which includes speeding, reckless driving, and ignoring safety rules, distracted activities using mobile phones while driving, lack of attention in workplace, fatigue and exhaustion, sleep deprived drivers, overworked laborers, and substance abuse, alcohol, and drug consumption. Behavioral factors also include aggressive tendencies, that is, road rage and impulsive decision making. In experience, there are untrained drivers who did not have a proper license, and those who are working without proper safety knowledge, and non compliance with the safety measure, that people are aware that they should take safety measures, but they are non compliant, so they don't wear helmets, seat belts, or protective gears. Coming to the environmental factors, which include poor lighting, inadequate street lighting, increased risk of accident at nights, and certain weather conditions, that is fog, which reduces visibility, heavy rain, which increase the chances of slipping, and snowstorms. Coming to the mechanical factors, which include defective vehicles. If the periodic maintenance of vehicle is not done, so there are more chances of road traffic accidents. Infrastructure issues, if there are weak bridges, faulty electrical wiring, which leads to the electrocution in the vehicle. Road conditions, potholes, uneven roads, or poor drainage, and lack of the road signs. They all are the mechanical factors which contribute to road traffic accidents. Coming to the socioeconomic factors, the low literacy rate is the most important contributing factors. That lack of awareness about the safety and safety rules and the traffic rules, which contributes to a lot of accidents. Then poor traffic laws implementation, and there are overcrowded areas and overcrowded buses, particularly public transports, and poverty, lack of safety tools result in domestic accidents. So accident in developing countries differ from developed countries because in developing countries the two-wheelers are involved, mostly motorcycles are used, pedestrians are more, and there are overcrowded buses in Pakistan. There are weak law enforcement and obviously careless attitude of people towards the safety rules. So how can we prevent a road traffic accident? The first important thing is engineering and infrastructure improvement. So there should be proper road designs with signage, speed bumps, and pedestrian crossings. There are traffic signals should be there, road marking and visibility, use reflective paint, road studs, and proper street lighting for nighttime safety, dedicated lanes, separate lanes for heavy vehicles, motorcycles, and bicycles, and speed control measure, install speed breakers and cameras. Speed basically low speeds have better outcome. Speed limit zone, if the speed limit zone is 30 km per hour, so if it is below 30 km per hour, the 90% chance of survival are there if an accident happen. And if the speed is between 40 km per hour or above, then there are chances of 50% of survival during an accident. Motorcycle helmets, they obviously reduce the risk of death by 40% because they prevent head injuries and severe injury. They can also prevent severe injury by 70%. And seat belts and child restraints, wearing seat belts reduces the risk of fatality. Front seat 40 to 45%, rear seat 25 to 75%, and child restraint reduced death 70% in infants and 44 to 80% in small children. So we should encourage that the child they should be seated on back seats rather than the front and rear seats. Prevention of RTA. The second important thing is law enforcement and regulation. Speed limit. There should be strict enforcement of speed limits in crowded and near the populated area. Seat belt and helmet laws mandate seat belt for all passenger and helmets for motorcyclists. The person who is driving as well as the person who is sitting on the rear seat, he should also use the seat belt. Then zero tolerance for drunk driving and ban on mobile phone use during driving, and vehicle fitness, that the regular inspection of the commercial and private vehicles should be done. Public awareness and education, driving training, promote defensive driving courses and strict licensing policies, road safety campaigns, use media to educate people about the safe driving behaviors, emergency response and post crash care, rapid ambulance services should be available, first aid training should be there, trauma centers, and data collection and analysis. This is the table which is showing the three E's for the traffic and auto safety. The first E is education, that you should promote the seatbelt use. You should aware people, discourage impaired driving, and promote child safety seats. The second measure is engineering, which is basically vehicle crash worthiness. That is proper maintenance of vehicle should be there. Seat belts, airbags, locking seat belts for child seats, and enforcement and enactment, that passage and enforcement of the primary seat belt laws, speed limits, and impaired driving force, they should be implemented. Coming to the domestic accident, the domestic accident refers to injuries that occur with the home or residential environment. These accidents can happen to individuals of any age group, but are particularly common among children, older adults, and people with disabilities. The common domestic accidents include falls, drowning, electric shock, burns, choking, suffocation, fire, and poisoning. The first one is fall, which is most common in children and older adults and construction workers. The causes are slippery floors, uneven surfaces, poor lighting, and the most common falls are fall from roof, balcony, stairs, and in washrooms. They are most common. Prevention, so we should use of grills on windows and balcony. There should be safer design of stairs, balconies, roofs with railings and bars. There should be safer working technique for construction workers and safe furniture and house designs. Drowning. WHO define drowning as the process of experiencing respiratory impairment from submersion, immersion in liquid. It can result in three outcomes, that is fatal drowning, which leads to death, non-fatal drowning with injury, and non-fatal drowning with long-term effects. The risk factor for drowning, it is most common in younger children, that is from 1 to 4 years of age, and adolescent 15 to 24 years who are who likes doing swimming. Then gender, more common in male than in female. Lack of supervision of children, inability to swim, boating accident, flood and natural disasters, poor water infrastructures, and medical condition such as epilepsy. So, how can we prevent and control drowning? There should be strict supervision of the children, avoid swimming alone in unsafe conditions, use of safety equipment, wear life jackets while fishing and boating, ensure availability of weather reports to fishermen and those working on river and seas, use barrier fencing around water bodies, safe water crossing, warning sign, and supervised swimming areas, teach water safety, raise awareness in communities, and discourage alcohol use around water, and promote swimming lessons, basic rescue skills, and CPR training. Burns. Burns are a common cause of injury at home and in workplace, especially among children. The burns, they can be classified as thermal, chemical, electrical, and radiation burn. The thermal burn, they are caused by flames, hot liquids, steam, or hot objects. The chemical burns, they are due to the contact with strong acid, alkalis, or cleaning agent. The electrical burns, they occur from contact with faulty wiring, power lines, and electrical appliances. And radiation burn are caused by exposure to excessive sunlight, that leads to radiation burn, that is sunburn or radiation therapy. The risk factors, children age 0 to 5 years are more prone. Use of open flames, kerosene stove, or unsafe gas stoves, faulty wiring, overloaded circuits, or uncovered electrical outlets, unattended candles, smoking indoors, flammable furniture material, unsafe handling of chemicals, fuels, and boiling water. cleaning agent, acids, and kerosene stored in accessible or mislabeled containers, and alcohol and drug use increases risk-taking behavior leading to fire-related burns. So how can we prevent burns? We should install smoke detectors and check batteries regularly. Keep hot liquids, kettles, and cooking pots out of the children's reach. Use stove guards and keep pot handles turned inward. Lower water heater temperature to below 49 degree. Keep matches, lighters, and chemicals locked away. Ensure proper electrical wiring and avoid overloaded sockets. Use flame resistance clothing for high risk workers. Promote safe cooking stoves in low income settings, enforce building fire safety codes, promote safe cooking stoves in low income settings, and community education on first aid and fire hazard. Poisoning. WHO estimates that there are over 1 million poisoning cases occur annually, leading to significant morbidity and mortality. Children under 5 and industrial agricultural workers are most vulnerable. The risk factors are children and elderly. They are at high risk due to the curiosity, poor judgment, or polypharmacy. Unsafe household storage of medicines, chemical, pesticides, and kerosene, improper labeling or storing chemicals in drinking or food containers, medication issues such as wrong dosing, self medication, and look alike or sound alike medications, occupational exposure to pesticide, industrial chemicals, gases, or heavy metals, socioeconomic factors like low literacy, poor housing, weak regulation of toxic substances, which leads to the easy access of these toxic substances to everyone. Then behavioral factors including substance abuse, alcohol intoxication, or mental health disorder, and environmental conditions such as poor ventilation. So how can we prevent poisoning? That there should be safe storage. Keep medicines, chemicals, and pesticides locked away and in original label containers. Child safety. Use child-resistant caps and keep hazardous item out of the reach of the children. Education. Teach families about poisoning risk and correct medication use. Environmental safety. Ensure good ventilation to prevent gas, that is carbon monoxide poisoning, which is very common. Regulation. Control sale and use of toxic chemicals. Enforce occupational safety and PPE, that is personal protective equipments. And early action. Have poison control contacts available and recognize early symptoms. Medical care. Provide prompt medical treatment and avoid unnecessary or harmful interventions. Industrial accidents. The Southeast Asian region faces significant burden of accidents, occupational accidents, according to the WHO and International Labour Organization (ILO). Occupational injuries are the leading cause of mortality and morbidity in the region. The risk factors are the human factors, that is lack of training, fatigue, stress, human error, substance abuse, and inexperience. Workplace hazard, there is faulty or poorly maintained machinery, hazardous chemicals, poor lighting, ventilation, slippery floors, extreme temperatures, excessive noise, organizational issues, weak safety culture, poor supervision, lack of safety policies, production pressure and long working hours, communication gap, there are inadequate warning signs, poor labeling, language barriers, and lack of reporting system. And external factors, that is outdated technology, low worker literacy, weak government regulation, temporary or contract workers unfamiliar with the environment. Prevention strategies. There should be enforcement of occupational safety regulations, mandatory use of PPE, that is helmet, gloves, goggles, regular workplace safety training and emergency drills, quick first aid response and access to emergency care, monitoring workers' health through periodic medical checkups, rehabilitation program for injured workers, and compensation and delivery disability benefits. Coming to the Haddon's matrix, Haddon's matrix is a widely used public health framework for analyzing and preventing injuries. It is developed by William Haddon Jr. in 1970s. It is a tool that combines the epidemiological triangle, that is host, agent, environment, and levels of prevention. These combinations give a way to look at planning for injury intervention and prevention strategies by phases in time of the event. This framework is useful in injury epidemiology, traffic safety, disaster management, and workplace safety. It is to fill 12 empty boxes where two elements intersect with a risk factor for an interventional strategies. This is the diagram of the head-on matrix. On the upper horizontal part, you can see that there are there are the components of epidemiological triangle, that is host, agent, and physical and social environment. And then there are the prevention strategies which can be taken during event, and post-event phase. The matrix, it consists of three phases and three categories, as we have talked of earlier. It consists of epidemiological triad and levels of prevention that can be taken during event, and post-event phase. So we will see this with the example of RTA. Steps in using head-on metrics. The step one is use community data to determine injury problem that require an intervention. In step two, brainstorming potential ideas for intervention and fill them into the cells of head-on metrics. And in step three, make decision about best intervention option based on effective strategies and practical to implement on your local situation. So this is the example of RTA. As you can see in the upper part, there are the components of epidemiological triangle: host, agent, environment, and there are phases, that is pre-event, event, and post-event phase. So these are the factors which are host related and that can be prevented in pre-event phase. So driver training and licensing, avoiding alcohol and drugs, public awareness campaigns, and seat belts and helmet use. Similarly, the agent factors, which include vehicle maintenance and safety checks, anti-lock braking system, electronic stability control. And environmental factors include road sign and maintenance, speed limit and enforcement, traffic signal and pedestrian crossing, and law enforcement. Similarly, the during the phase of event, we can wear seat belts and helmets, proper seating position, airbag protection. The agent factors are crash-worthy vehicle designs, proper tire grip, and side impact protection. And environmental factor includes energy-absorbing road barriers, safe road intersections, and proper lighting at night. And similarly, this goes for post-event. Coming to the recent advances, this is an article which states the road traffic injuries, quality of the pre and post hospital care in Pakistan. So the study, it aims to investigate the risk factors for road traffic injuries and assess the quality of pre and post hospital care. This was a cross-sectional study and it was conducted in Lahore from July 2020 to December 2022. The article was published in 2023. In the results, they found out that the data analysis showed that the age group of 16 to 30 years, around 27%, and older than 55 years, 27%, comprises the substantial proportion of RTAs. A total of 65% of the road traffic casualties attributed to the human errors or factors, and most road crash victims, 88% and 87% respectively, were not wearing helmets, and they did not hold a valid driving license. And there was also a significant gap between the perception and expectation of patient receiving healthcare services. Coming to the multiple choice questions. The first MCQ is: a 42-year-old man driving a car at night on a highway at 120 km per hour collides with a stationary truck parked on the roadside without reflective markings. Which of the following pre-crash phase environmental factors contribute to this accident? A. Lack of speed regulation enforcement on highways. B. The driver's high speed and fatigue. C. Absence of reflective warning signs on truck. D. Poor hospital trauma care services in this area. The driver's failure to wear a seat belt.
Charlie.
Yes, C is the right answer. Second MCQ is: a 50-year factory worker suffered facial burns due to an explosion while handling flammable chemicals. What could have prevented this accident? A. Working without safety goggles, smoking near chemical storage. C. Wearing personal protective equipment. D. Keeping chemicals in open containers. E. Using bare hands to handle chemicals.
C.
Yes, C is the right answer. The third MCQ is: analysis of burn injury after a community fire outbreak reveals delay in evacuation due to blocked exits. Exits, which action aligns with the injury control through environmental modification? A. Conduct awareness session on fire hazard. B. Ensuring building meet fire safety code with unblocked emergency exits. C. Regular fire drills. D. Training hospital staff for burn triage. E. Promoting safe cooking practices.
Charlie.
No, B is the right answer. There should be unblocked emergency exits. Fourth, a community health program trains school teacher in basic life support and fire evacuation drills. Which public health strategy does this best represent? A. Screening. B. Disaster relief. C. Secondary prevention. D. Surveillance. E. Capacity building.
E.
Yes, E is the right answer. The fifth MCQ is: a district health officer wants to prioritize intervention to reduce the burden of RTAs. Which measure represent a population level primary prevention strategies? A. Providing first aid box to ambulances. B. Increasing the number of trauma surgeons. C. Enforcing speed limits through automated cameras. D. Introducing advanced neurosurgical units. E. Compulsory physiotherapy after road traffic accidents.
Charlie.
Yes, C is the right answer. The next MCQ is: after a mass burn incident in a factory, most workers report that they do not know where the nearest fire extinguisher was located. What is the most appropriate prevention strategy for the future risk reduction? A. Conduct regular fire drills with mandatory participation. B. Improve fire extinguisher design. C. Increase the number of extinguishers. D. Provide burn ointment in all departments. E. Increase salaries to improve job satisfaction.
Alpha.
Yes, A is the right answer. Conduct regular fire drills with mandatory participation. Uh, Seventh MCQ is: a trauma center reports a growing number of motorcycle road traffic accident among food delivery riders. Which upstream policy would most effectively reduce the burden? A. Offering discounts on motorcycle. B. Training drivers in advanced riding skill. C. Regulating maximum working hour and enforcing rest breaks. D. Providing free first aid kits. E. Encouraging riders to take short routes. The right answer is C. Regulating maximum working hours and enforcing rest breaks. 8. A 60-year-old woman suffers third-degree burn after a gas cylinder explosion in her home kitchen. Investigation reveals that the gas pipe was leaking and she was using a matchstick to ignite the stove. Which of the following represent an environmental intervention in the pre-crash phase to prevent similar incidents? A. Providing first aid training to family members. B. Encouraging the use of electric stove instead of gas. C. Ensuring timely hospital transfer for burn victims. D. Promoting awareness about fire safety through media campaigns. And installing gas leak detectors in kitchen. The right answer is A. Providing first aid training to family members. Ninth MCQ is: a public health survey finds high fall rates among construction workers. The most effective engineering control is A. Daily toolbox safety meetings. B. Mandatory protective helmets. C. Providing brochures on fall dangers. D. Installing guardrails at elevated work areas. E. Introducing annual safety exams.
Delta.
Yes, D is the right answer. Installing guardrails at elevated work areas. The last MCQ is: a rural area reports frequent unintentional pesticide poisoning among farmers. Which public health intervention most directly targets the environmental causes? A. Training farmers in CPR. B. Providing gloves and masks. C. Establishing a poison control center. D. Regulating safe pesticide storage and labeling. E. Conducting awareness TV campaigns.
Delta.
Yes, D is the right answer. Regulating safe pesticide storage and labeling. This is the key to MCQs. These are the references, and thank you.